Hey guys, welcome back to another Anatomy of Pain video. In this series of videos, I'll be talking about the most common causes of pain in different regions of the body, and today we'll be covering the elbow. So let me start from the top and go down a little bit, and I'm going to start with the tricep. The most obvious cause of pain that the tricep can have at the elbow is located where the muscle meets the bone at the tricep tendon. So if you've been doing a lot of overhead pressing or bench pressing or tricep extension movements, such as the tricep extension on the rope at the cable system at the gym, and you're experiencing some pain on the back of the elbow, chances are you're experiencing some tricep tendonitis. A less kind of common, however, very serious condition that can cause elbow pain is radial nerve palsy. So let me explain to you what that is. The radial nerve is just a nerve that's located on the outside of the elbow. Let me highlight that for you here. If this would let me. All right, it's wanted me to highlight the humerus. So the radial nerve located right here. If I zoom in a little bit and kind of pan and tilt the model so you can see a little bit clearly where it's located on the outside of the elbow, off to the kind of the front portion of the elbow there. If I pan up, you start to also see that it actually pierces through the lateral head of the tricep. Let me zoom out so you can see that more clearly. You see that? So the radial nerve actually pierces through, like I said, the lateral head of the tricep. So if you've been doing a lot of pressing movements, if you're doing a lot of elbow extension movements, and you're experiencing a couple of pain and issues with the outside of the elbow, chances are you're compressing on the radial nerve due to the increased intensity and also increased frequency of pressing and extension movements that you're doing. And you're stressing out the lateral head of the tricep, thereby compressing the radial nerve, causing kind of elbow pain off to the outside. And this pain is insidious because a lot of times it can be misdiagnosed as lateral epicondylitis. And for example, you go to a PT or you go to a chiropractor and they're working on the muscles of the lateral epicondyle, kind of the muscles on the outside of the elbow, and you're not receiving much relief. Chances are the pain is not coming from the lateral muscle group at all of the elbow, and the pain is coming from the tricep. So if that's you and you've been getting a lot of work done on the outside of the elbow and you haven't been getting much relief, look upwards into the tricep, maybe have some work on those muscles as well, and see if you can get some relief, okay? In line with this kind of radial nerve type of issue, let's talk about another very important muscle that can compress on the radial nerve as well, and that is the muscle of the supinator. Okay, so again, this muscle is located on the lateral portion of the elbow, and it does belong to a group of muscles that can cause lateral epicondylitis. So lateral epicondylitis is an umbrella term for muscles that can cause pain on the outside of the elbow, and this is also known as tennis elbow. Okay, so people who play a lot of racket sports, tennis, badminton, maybe even ping pong, etc., or let's say someone who also does a lot of throwing type sports, so mainly baseball, football, etc., can experience lateral epicondylitis. And let me explain. So there are two movements that involve the forearm, and that's kind of in rotation type of fashions, right? So the movement of bringing your palm from palm down to palm up is a movement of supination, and the opposite way from going from palm up to palm down is pronation. So when a player, for example, in tennis, follows through in their tennis swing, say forehand, if you're a right-handed swinger, the movement of your forearm is going from supination into pronation. So you're actually using the muscle of the supinator to slow down the movement of pronation. And you're using that muscle of the supinator in an eccentric fashion. The movement, eccentric movement, just describes when you're using a muscle while it's being lengthened. And when you're contracting a muscle while it's being lengthened, there's this kind of push-pull pattern of contraction going on in the muscle, which more commonly leads to injury of that specific muscle. Hopefully that all made sense. So if you're swinging through a lot in your forehand, or if you're following through a lot in your throwing type patterns and you're experiencing some lateral elbow pain, chances are your supinator has been overused in this eccentric type of fashion. And when that muscle gets inflamed, it can cause obviously lateral elbow pain. However, it can also compress on the radial nerve, leading to pain located on the outside of the forearm into the thumb. So if that's you and you kind of fit this criteria of being a racket or throwing type of athlete, and you're experiencing pain on the outside of the elbow into the outside of the arm and thumb, look to the supinator and the other muscles of the lateral upper condyle as far as why you're experiencing this pain. And again, we'll be going over some strategies on how you can manage those issues on your own in a future video. For now, let's move into another muscle. It's actually the muscle located on the outside, or sorry, the opposite side of the elbow, known as the pronator teres. So the pronator teres does the exact opposite movement as a supinator, so it brings your palm from palm up to palm down, and it leads to an issue or a condition called the medial epicondylitis, also known as the golfer's elbow. So let's say you're a right-handed golfer and you're swinging the golf club down towards a ball. When your golf club impacts the golf ball, you're going from the movement of supination, the right hand, so the right arm, into pronation. Okay? When the golf ball impacts the ball, your golf club wants to pull in your forearm into supination, and you're using the muscle of pronation to resist that type of movement. Again, you're using the pronator in its lengthened fashion, in its eccentric type of pattern, again, opening up a more common way of injuring the pronator muscle. So when that pronator muscle gets inflamed by this overuse in this eccentric type pattern, this muscle can get inflamed and lead to pulling of the insertion point of that pronator muscle into the bone and causing medial epicondylitis. Do that enough, and you'll also injure a nerve that actually lays in very close proximity to the pronator, and that's the median nerve. So let me highlight that again. So the median nerve, if you can see here, it drapes underneath. In some people as well, just depending on your genetic variation, in some people this muscle can also pierce through the pronator teres muscle, and it goes down into the front portion of the wrist. So when this muscle gets tight enough, or you use this muscle over enough or often enough to lead to inflammation, it can compress on the median nerve, leading to a carpal tunnel type of symptom. However, it's not a true carpal tunnel because the problem here is not originating from the carpal tunnel. It's actually originating from the pronator teres muscle, which is located on the medial forearm. So if you've been playing golf a lot and you're experiencing some medial elbow pain that leads into wrist pain and almost numbness and tingling going down in that pattern as well, chances are your pronator teres has been overworked and you're compressing on the median nerve, causing all these signs, symptoms, and types of conditions to occur as well. Okay? So that's all that I really have for you guys today. Hopefully this was helpful. If you have any questions, please feel free to leave them in the comment section below. If you're on Instagram, please give us a follow. If you're on YouTube, please subscribe. And again, if you have any questions, please leave them in the comments below. And also like this video, helps us out a lot as well. That's it for now. I'll see you guys on the next one. Thanks.